Music and art are no longer viewed as simple wellness activities. Today, they are recognized as precision tools for neuromodulation. By serving as clinical interventions, they actively stimulate the nervous system and trigger tangible physical changes. These interventions physically reshape neural architecture, effectively rewiring the brain to promote healing and restore function. Art and music are now at the forefront of neurological medicine, providing data-driven pathways to recovery. Neural entrainment is the primary mechanism by which music and art affect the brain. It is the process where internal brain oscillations synchronize with external rhythmic stimuli. When we hear a rhythmic beat or observe a repeating visual pattern, the brain's internal activity adjusts its frequency to align with this external input. This effectively tunes the brain, guiding its electrical activity towards a specific state, such as calm or focus, through frequency matching. By leveraging these rhythmic cycles, we can use sensory inputs as a tool to modulate neural activity. Our brains operate through electrical oscillations that can be measured in hertz. These frequencies are not just noise, they are the indicators of our current neurological state. By targeting specific frequencies, we can influence brain activity. Slow delta waves correspond to deep sleep, while alpha waves signal a relaxed state. High gamma activity is linked to enhanced focus and peak cognitive performance. Precision tuning of these frequencies allows us to transition the brain between states, guiding the nervous system toward optimal regulation through carefully calibrated rhythmic stimuli. The 40 Hz protocol represents a landmark discovery in neuro-rehabilitation. By delivering precise auditory and visual stimulation, we can induce specific neural states. At the core of this protocol is the induction of gamma waves, which oscillate at 40 times per second. Clinical research shows that this frequency helps clear amyloid beta plaques, which are hallmarks of early-stage Alzheimer's disease. By clearing these neural obstructions, the brain demonstrates improved executive function, offering a new pathway to support cognitive health. Neuroplasticity is the brain's remarkable ability to reorganize itself by forming new neural connections. This process is the foundation of recovery and learning. By engaging with creative stimuli, the brain is forced to grow, effectively rewiring its own architecture to heal and adapt. This dynamic structural change is what turns artistic and musical engagement into genuine neurological medicine. The vagus nerve is the primary controller of our parasympathetic nervous system. Through rhythmic auditory stimulation, we can influence its activity. By introducing specific, slowing rhythmic tempos, we signal the brain to transition from the high-stress fight-or-flight mode into the restorative rest and digest state. This neuromodulation technique essentially rewires the body's physiological response, promoting healing and emotional equilibrium. Bioadaptive music represents a cutting-edge convergence of AI and neuroscience. It functions as a closed-loop system where physiological data directly influences the therapeutic stimulus. Advanced wearable sensors continuously monitor your heart rate variability and EEG brainwave patterns. This creates a real-time stream of biological data. An AI engine analyzes this data, instantly calculating the specific tempo and frequency adjustments needed to guide the nervous system toward a state of calm. By matching the music's cadence to your current physiological baseline, the system stabilizes heart rate and induces deep relaxation, effectively acting as a digital sedative. Art is no longer just a subjective experience. Today, digital painting interfaces turn creative expression into a quantitative data stream. By tracking stroke cadence, or the rhythm of movement, and the pressure applied to the digital stylus, clinicians can extract precise insights. These subtle variations in motor control serve as early-stage digital biomarkers, allowing us to identify conditions like Parkinson's disease long before traditional symptoms appear. By analyzing these micro-patterns, we are effectively using the creative act as a sophisticated diagnostic tool for neurological health. Virtual reality and augmented reality art therapy create immersive 3D spaces that facilitate bilateral stimulation. This process is similar to EMDR, or eye movement desensitization and reprocessing. By encouraging the patient to draw and interact within a 3D environment, the brain engages both the left and right hemispheres simultaneously. This coordinated activity helps the brain access and reprocess traumatic memory circuits that are typically difficult to reach in standard talk therapy. As the patient moves through the virtual space, the consistent bilateral engagement acts as a bridge, allowing the brain to move from a state of emotional reactivity to one of calm integration. Rhythmic auditory stimulation, or RAS, is a powerful clinical standard for stroke survivors. It uses steady, metronomic pulses embedded in music to guide the brain's motor centers. By matching their physical movements to these rhythmic beats, patients synchronize their motor output. This process significantly improves motor gait symmetry, which is often severely impaired after a stroke. Clinical data confirms the efficacy of this method. Stroke survivors participating in RAS-based protocols demonstrate a 30% faster recovery in gait symmetry compared to traditional physical therapy alone. The future of music therapy lies in precision medicine. We are moving toward a model where physicians prescribe frequency-based playlists with the same clinical rigor as traditional pharmacotherapy. Much like how SSRIs target specific serotonin receptors, these targeted soundscapes are designed to modulate specific neural circuits. By matching precise auditory frequencies to the brain's individual electrical signature, clinicians can guide the nervous system toward optimal regulation. This data-driven approach allows for clinical titration, ensuring that the intervention is not just relaxing, but therapeutically transformative for the patient's unique baseline. Neuro-rehabilitation is transcending the walls of the clinic. We are witnessing a monumental shift toward home-based care models. By leveraging consumer-grade EEG headbands, patients can now engage in daily, highly monitored therapeutic sessions within their own living space. These devices provide continuous data streams, ensuring consistent, long-term neural maintenance and precise adjustments to rehabilitation protocols. This evolution bridges the gap between clinical intent and daily implementation, fostering true neuroplastic recovery. Architects are now utilizing neuroaesthetics to transform hospitals from mere buildings into therapeutic tools. This field applies neuroscience to optimize the physical environment for patient recovery. By precisely controlling lighting and sound frequencies in common areas, spaces can now automatically regulate the autonomic nervous system of both patients and staff. This integration reduces cortisol, shifts the body into a parasympathetic rest and digest state, and fundamentally supports the biological foundations of healing. As we design with the brain in mind, hospitals will no longer just treat illness, but actively participate in the patient's neurological and physical restoration. The intensive care unit is a high-stress environment, often requiring heavy sedation to manage patient agitation and pain. However, clinical music therapy is changing this landscape. A 2026 meta-analysis revealed a groundbreaking result. Clinical integration of music therapy effectively reduced the requirement for heavy sedative medications in ICU patients by approximately 22%. By providing precise rhythmic auditory stimulation, we can guide the autonomic nervous system toward a state of rest and digest. This reduces physiological stress, allowing patients to heal with significantly less pharmaceutical intervention. Neurobiologist Dr. Elena Vance notes, we treat these as exogenous data inputs that the brain uses to rewrite its own operating system. We are effectively guiding the brain towards self-repair, treating therapeutic stimuli as precise information for neuroplastic change. A critical aspect of clinical neurotherapy is distinguishing between targeted neuromodulation and generalized pseudoscience. Much of the healing music found on social media lacks the clinical rigor required to actually shift neural states. True neuromodulation relies on specific frequencies titrated to an individual's unique brain state. General relaxation music acts as broad-spectrum noise, often failing to trigger the necessary neural entrainment. Blanket healing tracks found on social media platforms are not titrated. Without precise frequency targeting, they cannot act as a clinical scaffold for the brain to rewrite its internal operating system. Effective therapy depends on individual titration. Just as medication requires specific dosage, therapeutic sound must be calibrated to the patient's baseline neural architecture to be effective. Always prioritize data-driven clinical protocols over viral trends. Your brain is too complex to be left to guesswork. First, neural entrainment. This is the process where the brain's internal oscillations synchronize with external rhythmic stimuli. Think of it as the brain tuning its own frequency to match the rhythm of music or specific sound pulses. Next, neuroplasticity. This is the brain's incredible capacity to rewire itself. Through therapeutic art and music, the brain forms new synaptic connections, effectively rebuilding its own architecture. Finally, rhythmic auditory stimulation, or RAS. This clinical protocol uses precise rhythmic sound cues to help stroke survivors and patients with motor impairment achieve better gait symmetry and movement control. In the realm of neurostimulation, precision is paramount. Therapeutic sound functions much like a precise dose of medication. To effectively influence neural architecture, the sound must match the patient's individual neurological signature. When a frequency is tuned precisely, it achieves synchronization with the brain's internal rhythm. However, using a mismatched or discordant frequency introduces clashing oscillations. This creates neural interference, which can lead to increased stress and agitation instead of the intended therapeutic calm. Precision allows the brain to guide its own repair. Without this accuracy, the exogenous data input fails to align with the brain's operating system, rendering the therapy ineffective or even counterproductive. We view music and art as sensory scaffolding. When neural networks are disrupted by trauma or injury, the brain requires an external framework to guide the process of rebuilding. Think of this scaffold as a structural guide. By providing rhythmic and aesthetic consistency, these inputs help the brain reorganize its synaptic pathways into a more stable and efficient state. This process effectively uses external data to rewrite the brain's internal operating system, proving that these interventions are fundamental tools for neurological recovery. We are moving toward a hybrid medical model. This future integrates traditional pharmacology with targeted, non-invasive, digital aesthetic stimulation. By using artistic stimulation as a digital supplement, we provide the brain with the precise sensory inputs it needs to rewrite its operating system. This combination approach allows for personalized recovery paths, essentially treating digital art and sound as precision medicine. For those seeking the benefits of neuromodulation therapy, the path forward must be rooted in clinical standards rather than consumer wellness trends. Practical implementation relies on three core pillars. First, evidence-based care requires baseline diagnostic data, like EEG readings, to map individual neural states. Second, intervention should be managed by licensed therapists. These professionals understand how to apply stimuli effectively, avoiding the pitfalls of non-specific home apps. Third, the therapies themselves must utilize precision frequency modulation, targeting specific neural circuits rather than broad, undefined relaxing tones. By prioritizing clinical data and expert oversight, we transition from simple relaxation to true neurological intervention, guiding the brain toward measurable self-repair.